One of the first drug distributors to face felony charges for its alleged role in the opioid crisis announced it's going to stop distributing controlled pharmaceuticals.
Now, according to the CDC, since 1997, opioids have contributed to more than 400,000 deaths. Here to discuss what is being done to combat that crisis is Director of the Office of National Drug Control Policy, Jim Carroll. Director, we're so glad to have you here. Thank you so much.
Good morning. It's great to be on.
Thanks for joining, sir.
With the stars of Jeopardy also.
Well, who knew, right? So funny. So tell us, where are we in terms of the crisis? Have we seen the numbers ebbing off? Have we started to see a decline? And what actually works to deal with this?
Great question. First time in almost 30 years we've seen a decline in the number of Americans dying from an overdose. It's a 5% reduction. So when you think about 70,000 Americans, still far too many Americans are dying from this.
Yes.
But it's the first time in 30 years it's gone down. But it's a result of doing everything. It is working on the supply of drugs that are coming in, but it's also working on demand. It's getting more people into treatment, and it's spreading the message on prevention.
And so one thing I want to focus on with you, sir, is about fentanyl, particularly fentanyl coming from China. I know that the Chinese government has paid lip service to the idea that fentanyl will stop going through Mexico and being transmitted across the border. Have we seen actual reductions in that, as this, as I understand it, is the deadliest part of the opioid epidemic?
Fentanyl is no question some of the deadliest drugs that are out there, and it's causing the vast amount of fatalities across the country. China has stepped up. I went to China. First off, the president led a very strong message to them, got an agreement from the Chinese to stop and schedule fentanyl like we need to do here in the U.S., and that's happening this week in Congress. I went to China. I led a delegation from the White House, and we got a commitment from them to step up. Since that time, first prosecutions of fentanyl traffickers has taken place. 10 folks were prosecuted, and we have seen a dramatic reduction in fentanyl being shipped directly from China to the U.S. And so we really are hopeful that that is going to start making a difference. The problem is, you mentioned it, now it's going to Mexico, it's going to other countries, it's being transshipped through other locations. So it's whack-a-mole. We knocked it coming directly from China. Now we need to keep up.
Well, I mean, that is the thing is, look, we've been interdicting heroin in this country for 100 years. Right. And yet here we are with the worst addiction crisis probably in our nation's history. I mean, it is whack-a-mole. So how do you deal with that? How do you get to the root causes of the issue when it seems like no matter how much you seize, no matter how many traffickers you go after, more and more just continues to come?
One thing we absolutely need to do is to secure the southwest border. The seizures of drugs coming from Mexico in the U.S. has risen since the Border Patrol has been able to focus in on what they're supposed to do. It says on their patch, Border Patrol, that's what they need to do. Now that they're back doing that the humanitarian part of that is over, we're seeing seizures come up. One of the other things that we need to do is to address addiction in this country. Crystal, you nailed it. I'm so happy you said the addiction crisis. That's what I say. Of course, opioids are killing us. Fentanyl is deadly. And so people talk about an opioid crisis. We have to remember it's an addiction crisis. Addiction is a disease. We have 20% more people getting treatment than ever before. We need to keep pushing on that.
Sir, can you tell us about some maybe pilot programs across the country which appear to be working? There's a lot of different experiments in different localities. Which community has been able to successfully address the addiction crisis, or is there any that we've actually seen yet?
Absolutely. And I want to mention one in Huntington, West Virginia. They call it the Quick Response Team, QRT. Within 24 hours of an overdose and someone is revived, sent home, within 24 hours, there's 4 people that show up the door. Someone from the county health department or the city health department saying, we can help you find treatment, we're here for you. There's law enforcement, not in uniform, to say, if you have anything in the house, I'm just going to take it. We're not going to arrest you, we're not going to prosecute you, we're going to be able to do that. There's someone from the faith community to say, we can help put food on the table, we'll help your family, we'll foster your pet. I mean, all these reasons that people are hesitant to go into treatment. And then finally, a peer, someone to say, I've been where you are, we're not judging you. We can't judge these people. And there's 4 people right there. They're vulnerable, they're receptive because they just were saved. That is making a big difference in Huntington, West Virginia. Hats off to the mayor down there for doing this.
Yeah, wow. I've spent a good amount of time in Huntington, and we've interviewed the mayor here on the show. And I mean, it really is ground zero. I mean, they had such a massive number of overdoses. They had to deploy the National Guard to deal with the crime that comes with this, that that is, also a major issue that's straining budgets across the country. I want to ask you kind of a philosophical question, though. I mean, we look at the top line economic numbers. GDP is good, unemployment's low. We've been in this recovery and this boom cycle for, quite a long period of time now. So what is it? How can things be so good on that top line number and yet so many people in such despair that they would turn to these drugs to be able to sort of take them out of their day-to-day lives?
So much of the people who turn to this, there's a lot that turn to it innocently, if you will, because we know far too many doctors were writing prescriptions for pain relief.
Right.
And they got addicted that way.
Right.
But there are a vast majority, a lot of people who turn to these substances to help them with mental issues, to help them with the anguish of trauma or something that they were trying to escape. And so dealing with some of these underlying co-occurring issues, such as mental health, is key. We really need to put our arms around these people who have an addiction and say, we're here to help, we're going to deal with the problems that you have, and we're going to treat you as an individual.
So one of the other things is, the opioid crisis rightfully gets a lot of discussion, but there's a lot of other things that are going on in the country. I know we were talking during the break about methamphetamine. Have we seen a rise of methamphetamine across the country? What's contributing to that, and what are you doing about it?
We really have seen a rise in so many communities. We were talking about Huntington, West Virginia. We've seen a rise in meth use and meth availability throughout the U.S., especially in some of our rural communities. It is 4 times the purity and 1/4 the cost of what it was 5 or 6 years ago, 7 years ago.
How is that possible?
It's all coming from Mexico. It's all coming across the southwest border. And the purity that I talked about, it is just staggering, and it is so cheap. The meth seizures by Customs and Border Protection, God bless the CBP, these men and women that are down there. They are trying so hard to stop the meth that's coming in. But also we really do need to spread the message of prevention and explaining to people, this is no longer a grandfather's issue where you can experiment with something. The drugs that are out there today, it can be one and done. Try it once and you're addicted, or try it once and you're dead.
What do you make of the Portugal model? They've seen they were having huge issues like we are, right? Huge overdoses, was known as the heroin capital of Europe, right? And they decriminalized, they put treatment in place, they created safe injection sites and really brought people in so that they could get treatment. But the decriminalization part was really key. And now they have dramatically reduced overdoses. They've dramatically reduced rates of addiction. Is that something that you think we should look at and consider?
Well, we're certainly looking at the models of, and we support, the transfer of needles to make sure that these people get clean needles at these sites in the facilities. That's federal law. We support that. One of the things that we're first off, it's against federal law to have what is called a safe injection site. I really oppose that term, though, because it's hard to imagine that injecting yourself with heroin or fentanyl is ever going to be safe. Right. So I really don't like that term.
But it's part of this whole idea of harm reduction.
It's like a supervised injection site.
It is a supervised injection site. But the problem is, we're still spreading the message of telling people it's okay to experiment because we're going to be here to catch you.
Yeah.
I think, certainly.
Why do you think it's been so successful in Portugal then?
I think what it is, it's reaching the people that, have the addiction, but it is spreading the message of this is an acceptable thing to try, an acceptable path to go down.
But they have lower rates of addiction than we do now.
They do, but they've worked across the board. They have worked also on the supply side, and we have to do both. We have to work on the supply, and we have to work on demand.
And they don't have Mexico in their southwest border. I also want to ask you about marijuana, which is that the Trump administration seems to have taken a very lax, kind of approach to marijuana. We've allowed many of these states to legalize. They haven't been interdicted by the federal government, despite the fact that the Surgeon General has now issued a warning against marijuana use, particularly for teens. What is your office doing about that right now?
Well, what we're doing right now is making sure that the federal government understands and spreads the message of what is the effect on the body for long-term use of marijuana. The Surgeon General's report, actually, we know it has damaging the brain of people up to age 25. That is really concerning because that is inconsistent. When you talk about safe injection sites and decriminalizing, if we decriminalize it to that point, and people between the ages, of teenagers through 25 use it, we know without question that it impacts their mind. We've also seen a dramatic rise of use of marijuana by pregnant women, which also we know has a detrimental effect on the baby. And so these are things that we're very concerned about. We are very supportive of DEA, and we're pushing to make sure that they have more research available. There might be some, we've legalized, and FDA has scheduled one derivative of the marijuana plant for epilepsy in children. That's great. Let's study it more. Let's see what other derivatives might be possible to help people, but let's also make sure that we understand the negative consequences of long-term use of marijuana.
Yeah.
Director Carroll, thank you so much. Great
Thank you for having me on.
Really appreciate it.
Great to see you.
Great to see you, too.
Good to see you, sir.
Good to see you.
Coming up, Team Rising looks at the post-debate polls. We're going to tell you who's up, who's down, and what this means for the current state of the race. That is next.